In 2016, both Edinburgh and Belfast introduced speed restrictions in parts of their cities. On many roads in Edinburgh, in the city centre and in all residential areas, and in the city centre in Belfast, traffic speeds were reduced to 20 miles an hour. In Edinburgh, the scheme was led by the local council, and in Belfast by the Northern Ireland government. The schemes have been evaluated by a team of researchers from the universities of Edinburgh and Queen's University Belfast, with colleagues from the universities of East Anglia, Bristol, St Andrews, Cambridge, along with NHS Scotland and Sustrans. We have learned a lot of things about what happens when speed is restricted in this way, and we've also learned a lot about how to make it happen. We have learned about the way such schemes work. In this short film, we describe the story of how the schemes became a reality. Some scientists and public health advocates have suggested that speed restrictions are a quick and easy win. But it isn't as straightforward as it might sound. For schemes to work, they have to get to the starting blocks first. This isn't always easy. We realised we would have to understand the history of the way that 20 miles an hour speed restrictions became a political and physical reality in both cities. First off, the idea of speed restrictions in both cities had been around for a number of years. Plans had been in place and efforts had been made in both places since at least 2000 to bring speeds down, especially near schools. And there were already some schemes in place in Edinburgh and parts of Northern Ireland to reduce traffic speeds down to 20 miles an hour. This was important local context. But there were also a whole lot of other background factors which we needed to understand. These included the role of the United Kingdom government in Westminster, the role of the Scottish and Northern Ireland governments. It included all the regulations and policies already in place governing traffic speed, and the powers of local jurisdictions in both countries. It involved the attitudes of politicians, the press, pressure groups, head teachers, and the public. We had assumed that the scientific evidence would be a major factor. After all, the evidence looks very convincing. Many public health advocates assume that the argument is already won about speed. These schemes work, and the evidence in support of them is very strong. There are also clear guidelines, for example from NICE, based on the best available scientific evidence. Well, we found that evidence was important, but it certainly wasn't the only thing driving forward the policy. Getting the scheme started was a long, slow process. It took the determination of some local politicians and officials over a long period of time. Leadership was really important. The local leaders played a vital role in pulling the idea forward. We found that alliances between local groups within and beyond the administrations were really important too. It was also extremely helpful that in neither place was the issue overtly party political. So how did it happen? What are the lessons from Edinburgh and Belfast? Getting these initiatives in place was a long, drawn-out process. It took determination on the part of politicians and officials to get the schemes to the starting blocks. To plan and implement such schemes requires enormous tenacity and patience, attention to detail, and integrated working between different agencies within government, as well as other institutions and organisations. The job isn't done once the schemes are agreed. Both the subsequent implementation and delivery required continued effort to sustain momentum. As with almost all public health interventions, we're in for the long haul. Things seldom change dramatically overnight, and we're always working towards a longer-term goal of a healthier society. These schemes are in reality the early steps towards a much broader vision of a safer, pleasanter, cleaner, more sustainable urban environment. Getting the schemes to the starting block is the very first step of all.